We now proceed to the middle ear. The middle ear is bounded laterally by the tympanic membrane and medially by the promontory of the horizontal semicircular canal. There is a eustachian tube which is angled 45 degrees from the middle ear to the nasopharyngeal opening. And the middle ear houses the ossicles, which is the malleus, incus, and stapes. This is an otoscopic examination of a normal eardrum or tympanic membrane. As we can see, there is pars flaccida, pars tensa, the lateral process of malleus, and the cone of light. If the cone of light is located in the right side, this is the right ear. If the cone of light is located in the left side, then that is the left ear. Diseases of the middle ear. Otitis media is classified into acute otitis media and otitis media with effusion, which is the leading cause of childhood hearing loss. It is caused by an infection that ascends to the middle ear through the eustachian tube. Acute otitis media is mainly caused by Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. It is often preceded by infection of the upper respiratory tract, and patient will have bulging of the tympanic membrane, perforation of the tympanic membrane, otorrhea, otalgia, and fever. Otitis media with effusion refers to an inflammatory effusion behind an intact tympanic membrane. It is not associated with acute otologic signs and symptoms, but the major symptom is hearing loss because there is fluid behind the tympanic membrane. Otoscopy reveals an opaque, thickened, and occasionally retracted tympanic membrane. In the picture, we can see that there is air fluid levels behind the tympanic membrane. Otitis media with effusion have two types. We have the serous, which is an effusion caused by transudate formation as a result of rapid decrease in middle ear pressure relative to atmospheric pressure. Mucoid, which is a mucoid accumulation in the middle ear cavity, which impairs transduction of sounds in the ear and cause hearing loss. Chronic suppurative otitis media is an acute or recurrent infection of the middle ear which may result in a permanent perforation of the tympanic membrane. It is marked by the presence of persistent inflammatory changes within the middle ear and mastoid. The treatment for chronic suppurative otitis media are systemic antibiotics, ear drops, and adequate ear protection. Chronic suppurative otitis media with cholesteatoma. Cholesteatoma are formed due to recurrent or chronic ear infection, and they are epidermal inclusion cysts of the middle ear or mastoid. They characteristically erode bone of the ossicle and otic capsule, which can cause intracranial as well as extracranial complications. The treatment is surgical resection through mastoidectomy. These are the complications of otitis media, which is divided into intracranial, temporal, and extratemporal complications. In the intracranial complication, the most common is meningitis. In the temporal is facial nerve palsy, and the extratemporal is subperiosteal abscess.